often should one take their kids to a pediatrician? Should they visit them only if they fall sick? Or would you recommend regular checkups to monitor their growth and health?
Well, if you look at the immunization schedule, a baby at birth is seen by a pediatrician, and then in the first year and a half of life you have immunization coming at regular interval. That itself would necessitate a visit to a pediatrician. So that serves both the purpose, immunization as well as routine checkup. Beyond that age, I really don't think that a routine monthly checkup or annual checkup is required. Yes, children in the first 5 years of life, they are a little susceptible. They do fall sick and they are taken to the pediatrician. But on the regular routine basis, I don't think beyond the age of 2 years you really need to go and see your pediatrician every month unless you have some ailment. But yes, immunization should be completed in time, and if there are ailments, certainly would go to the pediatrician. So first 1.5 to 2 years of life, automatically because of this immunization, there are multiple visits at which growth and development is monitored, and that serves as a good routine checkup also.
So doctor, in this day and age, why do parents need to take their children's nutrition more seriously?
Well, we saw the problems associated with nutrition, both malnutrition as well as malnutrition. The problem of obesity and the health issues associated with obesity, diabetes, hypertension, heart ailments, and all these things are, obesity is the crux of the matter. So you need to tackle it very. See, anything in excess or anything which is deficient is bad. Malnutrition would lead to low immunity. Child would be susceptible and prone to get infected again and again. Similarly, overweight and obesity, we saw the problems. So children, and then this is something which is difficult to get out of once the child gets into a habit of eating junk or eating food which is not nutritious. So we need to take it really very seriously. And there are more than 20% children, as I said before, who are obese and overweight. And unless we control them, we are really going to run into a big problem.
Fever is very common in kids, especially in the monsoons. So doctor, when should parents take fever more seriously and take the child to the doctor?
Yes, fever is more common in monsoon because these common ailments and common infections are more common in monsoon. But two things. First of all, fever, many parents mistake normal body temperature, which is I would say the body of a child would appear a little warm to touch, and that is mistaken as fever by many parents. And if you really record the temperature on thermometer, they don't have fever. But if you talk about true fever, then fever, unless it is 100 or more, one should not really worry about it. As I said, fever should be treated as a friend and not as a foe. Fever is, part of our defense system. Like we boil water to sterilize, to take care of the germs in the water. Similarly, the body raises its temperature to take care of the viruses and bacteria that they get infected with. So fever should be, fever is certainly would connote that there is some infection, but one need not really get worried about every small fever here and there. But certainly there are certain symptoms, what we call as red flag, a very high fever, definitely documented fever, fever associated with child who is irritable, who is not eating well, or has associated signs and symptoms like flu-like illness, you have running nose, cough, little rapid breathing, some spots on the body. Yes, one should certainly take this fever seriously and consult a doctor. If not a pediatrician, at least a doctor.
Doctor, the second most common cause of absenteeism in school is stomachache and diarrhea. What are the most common causes of these, and how can one prevent them? And when should parents take it seriously and take the kid to the doctor for the same?
Well, stomachache and diarrhea is a common problem in our country. This is caused by, most of them by viral infections, where a child gets infected, the alimentary system gets infected, he would have vomiting, he would have griping stomach pain, and then he would have loose stools. But fortunately, most of the time these are self-limiting things. The only care that parents need to take is see that the child does not get dehydrated. whatever loss of water takes place from the body, that has to be replaced, not with plain water, but water with sugar salt solution. ORS is something which is known to every individual in this country, and a child should be fed with ORS in quantity as much as he is losing. Excess will be thrown out in the urine. One need not worry on that ground, but dehydration should be prevented. Parents should be alarmed if the child has persistent vomiting, he is unable to take orally, he has high fever, passes less urine, or he starts passing blood in stools. These are the things where child is listless, is inactive, or looks dehydrated. Then yes, certainly they need to consult a doctor. But these things can be prevented definitely. One is hygiene, good nutrition, and then there is a notion that if the child has loose motions, immediately parents should stop giving them orally. That should never happen. The child should continue to eat whatever he is used to. In addition to that, he should take additional liquids in the form of ORS or homemade sugar salt water in quantity which is required by the child every day, and over and above that he should also make up for the losses that are taking place because of vomiting and loose motions.